Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. We are excited this week because it is Mental Health Awareness Month, and we want to talk about the mental health issues that come along with migraine. We want to address them. And one of the best ways to start doing that is to talk to the Migraine Diva, who is a return guest of ours, and everyone knows and loves her. So say hello to Jaime Sanders. Hi, Jaime. How are you?
Hi, Lindsay. I'm doing well. Thank you.
Thank you so much for being here. Jaime is known as the Migraine Diva on her very popular blog. She is a mother, a blogger, a patient advocate. She's a super patient advocate. She's very open about her life with migraine, with depression, with anxiety. I call it the migraine trifecta. So many people have migraine, depression, and anxiety. We are 5 times more likely than the average person to experience depression if we have migraine. So we have had Jaime on before. She was super popular. She is always so awesome to listen to. So I wanted to start out by asking you, Jaime, for anyone that didn't hear us when we talked to you before or who doesn't know your history, can you tell us, when did your migraines and your depression first begin?
Sure, absolutely. So, migraine has been in my life my entire life. So, basically, since I was a toddler, but my parents didn't know that I was experiencing abdominal migraine at the time. But my first classic migraine attack was when I was 8 years old.
Mm.
And I can, looking back now, see that the depression kind of sat in around that same time also because of the trauma of migraine when you're a child. And that's exactly what it is. It takes so much away from you, and you're trying to figure out how to navigate this painful condition while you're growing up and you're going to school and you're making friends and forming relationships and trying to maintain your schoolwork and other extracurricular activities. And kids can be extremely mean, and your teachers don't always understand. And I grew up in an age where your teachers were way older than you. So they were from a completely different generation. So they were of the mindset of when a child is complaining that it could be just seeking attention or overreaction.
Mm-hmm.
So it's completely different than what children may be experiencing from their teachers now, because they tend to be a lot younger and tend to understand and be more empathetic.
Mm-hmm.
So there was definitely depression setting in at the age of 8. And I remember being called melancholic a lot in my childhood. And I can never understand why I can never seem to feel 100% happy or at peace with anything.
Mm-hmm.
And those are feelings I still struggle with today as an adult.
Mm-hmm.
So it definitely came, I say, around the same time as those migraine attacks really started to become more frequent in my life. And there definitely is a correlation to both. And when you don't have the language to describe what you're feeling, and when you're an adolescent and you're dismissible, and it's easy for adults to decide for you what you're feeling or explain away what you're feeling, it becomes that you become more introverted and more into yourself, and you fall more into those dark pits. And I definitely remember feeling that a lot as a child.
I love how you said that. It's easy for adults to decide for you how you feel. I can relate to that. I can remember that now that you said that. I remember a lot of feelings when I was small. My migraine started I don't have a memory without migraine, definitely by the time I was 4, it was pretty much daily. But I remember this constant question in my head as I grew of, does everyone have a headache every day? And they handle it better? Or am I the only one that has a headache every day? I constantly went back and forth trying to answer that question to myself. So it's such a confusing thing. I can totally relate. So can you talk to us now what it's like about living with migraine, depression, and anxiety, the whole trifecta? How do they feed off each other?
It is a horrible cycle. I think that's the best way I can put it. It's this vicious cycle. It doesn't matter which one starts first, but it triggers the others.
Mhm.
Absolutely. So, for instance, well, I have chronic intractable migraine. So, obviously, I'm in pain every day. That level of pain fluctuates. But if I am stuck at a level of pain where it's just not going down and none of my treatments at home are working, and I have to go through more extensive treatments, that is going to trigger the depression
Mhm.
because I'm tired of being in pain and I'm doing everything I can and nothing is really helping. And I'm tired of being in that situation over and over and over again. And that's going to trigger a lot of those negative feelings.
Right.
And then the anxiety sets in because I have to go and do treatments that give me anxiety because they make me feel horrible.
Mhm.
And so that one trigger of anxiety is going to cause other triggers of anxiety.
Mhm.
And so it becomes a lot more difficult to manage all of those triggers at once. It's extremely overwhelming to your body, not only physically, but emotionally and spiritually for me as well, because for me, I start to lose faith a little bit
Yeah.
and you start to lose hope because there's only so much strength you feel that you have.
Yes.
And to be constantly put through the ringer in the same situation over and over and over again to kind of not have a better result at the end
Mhm.
is very depleting and exhausting. And it's like, why am I stuck in this situation?
Mhm.
It's not fair. And so, of course, it's going to affect you emotionally and mentally, and you're going to feel sad
Mhm.
because this is not the life that you want for yourself.
Yeah.
And once you're in that, it's very difficult to get out of it. And what has helped me is constantly talking about my feelings. I have to talk about it and not let it sit and manifest.
Right.
Otherwise, it's going to grow into this untamable monster that's going to devour me. And I can't allow that to happen. So if I speak about what I'm experiencing, I take its power away.
I love that. I love that you say that. And I hope that everyone has someone that they can talk to like that.
Right. That's the
Yeah.
key. And that's the hard part sometimes is finding that person that you trust enough to be
Mhm.
that vulnerable with. Because when it comes to mental health and mental illness, there's so much judgment,
Mhm.
around those conditions. And finding that one person that you can talk freely to, whether that's a spouse or a really close friend or a family member, if you happen to have a really good therapist that you can call and set up an appointment with, whether it's over the phone or, telehealth, if
Mhm.
you can have a virtual, appointment, that's great. But even, resources like the suicide hotline, or
Right.
you can even text someone through those hotlines.
Yes.
Just, having that anonymity
Mhm.
and not feeling like, you feel safe in that regard where you can divulge everything you're feeling and not feel like you're going to be judged, or feel like you're letting anyone down per se,
Right.
because we have this overwhelming feeling of protecting those around us,
Mhm.
even when we're crumbling inside. And I
Right.
think that is a dynamic of mental illness that people who don't live with mental illness don't see. They see us as weak and incapable, but actually, what we're doing is trying to protect everyone else around us from what we are experiencing because we don't want them to be afraid for us,
Mhm.
and we want to shield them from that horribleness and that darkness that we feel. So
Yes.
there's a tremendous amount of courage and strength in the moments of our deepest weaknesses that people
Yes.
don't see.
I am going to skip to a question I was going to ask later because of what you just said. I have heard you in your talks say a statement that's very similar to a statement that I say, it's something we both say very often. It's that the people with migraine are the strongest people in the world in order to just get through the day. So
Yeah,
why don't you just comment on that statement really quick? Because I believe it's very true.
it's extremely true because you just never know what your day is going to be like,
Mm-hmm.
from the moment you wake up to the moment you lay back down,
Mm-hmm.
because so much can happen within those 24 hours
Mm-hmm.
that can completely disrupt your day.
Mm-hmm.
And we go through life dealing with a lot of symptoms. Doesn't necessarily have to be head pain 24/7,
Mm-hmm.
but that light sensitivity can just ruin your whole day.
It can.
Somebody can walk by with the strongest smelling aftershave or perfume.
Uh-huh.
Just going to the grocery store can trigger something.
Yeah.
You can be driving to work and they're doing construction, and the sound of that jackhammer will just ruin your whole day.
Yeah.
And your whole entire existence is about avoiding triggers.
Yeah.
So you have to manage all of these things. But yet, on top of that, you're still whoever you are in
Mm-hmm.
life, whether you're a father, you're a mother, you're a student, you have your career, you have whatever you're responsible for. And you kind of have to put all of those things on the back burner and take care of those priorities and responsibilities.
Yep.
And so we're experts at not taking care of ourselves
Mm-hmm.
because we just don't have the time to all the
Mm-hmm.
time, nor do we have the luxury to, because it's so all encompassing, it's everywhere. So you have to be pretty strong to be able to power through so much of your life
Right.
dealing with all of these external triggers that are trying to disrupt your life,
Mm-hmm.
yet you're managing to maintain a career and raise a family and maintain and manage a household and pay your bills and do all these other things. So you have to be incredibly strong and
Mm-hmm.
able to put that into some type of balance where you're able to get it together and keep it together.
Yeah, I think that there's even some of us, depending on how our disease manifests, I wake up in the morning in so much pain just getting out of bed.
Yeah,
It takes an amount of energy that I think most people could make it through at least half their day without expending. And there's a lot of people like that.
yeah,
So I think that our disease is unique in just the amount of energy it takes just to survive and push through. So I love that statement that you make sometimes when you give talks. Last time you were on Heads Up, you discussed how important it is that people don't personify their symptoms of their depression or their anxiety, that we dissociate our disease, whether it's mental or physical, from who we are as individuals. Can you talk about what that means to you?
absolutely. I came to a point, this maybe about 6 years ago, six or coming up on 7 years now, I think, where I just got tired of feeling bad all the time.
Mm-hmm.
And that had to do not only with the migraine, but also the constant barrage of negative emotions stemming from the depression and anxiety. And I got this idea one day that, you know, people with other conditions don't say, you know, I have asthmas or, or anything like that. They don't personify like I have cancers, or I'm experiencing cancer or all these other
Right.
things like that. So I'm like, why is it that with not only just migraine, but with mental illness, it's so personified? And even when we see our psychiatrists and our therapists, they use the same language. So it's constantly being told to us that we are those things.
Mm-hmm.
So we internalize that. And so we repeat that to ourselves. And I needed to break out of that because it was damaging me and it was causing harm
Mm-hmm.
and it was keeping me stuck. So I needed to be able to take its power away. I felt like it gave it way too much power.
Mm-hmm.
So instead of saying I am depressed, I started saying I am having a depression flare up or an
Mm-hmm.
anxiety flare up, just like you would have a flare up of any other condition like rheumatoid arthritis. You're having a flare up.
Right.
It's something that is there constantly. It's chronic, but
Mm-hmm.
it doesn't always occur every day. And
Right.
sometimes it gets really bad, and that's a bad flare up. That's what I'm experiencing. It's a bad flare up.
Right.
So I needed to change that language for myself. And then it was important for me not to keep that knowledge just for me. I
Mm-hmm.
needed everybody else to use that for whatever condition that they're or disease that they are living with, to take that power away from it
Mm-hmm.
and to remember that they are still a person worthy of living a bountiful life,
Right.
regardless of whatever limit have been put on them. There's still a tremendous amount of quality you can have.
Right.
It's just what your perspective, where you put your perspective.
I love it.
Yeah.
Yeah, I think it's important that every time we have you on that we discuss that, that it's not just the vocabulary, but it's where it came from. The idea of not personifying the illness, that it's not who you are at all. We can't just take on these ideas and make them who we are as an individual. I really love speaking about that when you're on. When I'm working with people who have chronic migraine, I always tell them to monitor both their physical symptoms and their mood, and to sort of pull over when they see the warning light and not when the car's on fire. I love using that analogy. I'm sure I stole it from somewhere. It's been so long, I can't tell you where, so forgive me. So what tools are most effective for you in combating your anxiety and your depression when you see the warning light?
When that happens for me, I try to use meditation as much as possible
Mm-hmm.
because that's going to center my thinking and
Mm-hmm.
it's going to put things back into perspective for me. And it really does help shift back into that positive framework
Mm-hmm.
instead of being stuck in that, or I could see that manifestation of that snowball occurring.
Right.
And I don't want that to create this avalanche that I can't control.
Mm-hmm.
So being very mindful of when that's happening, that's when I go to my meditation.
Okay.
And there are so many out there that focus solely on anxiety, or whether you're feeling whatever you're feeling a lack of self-love, or um, you just don't feel appreciative of yourself.
Mm-hmm.
Whatever you're feeling, there's so many things out there that can identify those particular emotions and address that. And I try to find something as close to what I'm feeling and work on that for those
Okay.
20 minutes.
Yeah.
And I feel like I owe it to myself because I don't always want to do it. I'm going to be honest. It's easy to sit in that funk. I'm exhausted. I don't want to do this. This sucks. I don't want to do anything. I don't want to feel anything. It's easier to be numb, right?
Mm-hmm.
Or I can do the work,
Right.
and it's 20 minutes.
Right.
So I do the work, and I wind up being able to sit outside on my patio after that and
Right.
want to be in the sunlight as opposed to still sitting in my bed
Mm-hmm.
or sitting in my room in the dark. And that's progress.
Right.
And whatever mechanism it is for that person individually, use that tool to help keep you from snowballing and turning into this avalanche of emotions that is going to keep you in your bed for a week.
Right.
It's very important to find whatever that is for you. Not meditation isn't for everybody, I understand, but that's what works for me. But
Right.
identify what that is for you and work that tool and get used to working it.
And,
Make yourself do it when you don't want to, because I know it's hard and there are going to be times where you're just not going to want to. And I'm guilty. I do that. I'm human. But as much as you can, take that time to do the one thing that's going to change your perspective and acknowledge, like, okay, this is the anxieties that's making me feel like this.
yeah.
It's not me. This is an irrational feeling, or this is the depression making me feel like I'm less than.
Mm-hmm.
It's not me. Acknowledge that, call a thing a thing. So then you start to separate yourself from it.
Right. I
And
love
then
to, oh, sorry, go ahead.
go ahead. No, and then you just, work your tool to help continue you on that path of separation.
I love how you say it's not me, it's not for me. I tell people it's when you feel the anxiety, it's not yours, it's not for you. It's like a blip in the matrix. You don't
Right.
have to pick it up. And so many of the people I work with, we use exercise, even if it's just a little bit. Going for a walk, I'll walk with them. If they like breathing exercises, we use breathing exercises. If they like meditation, we use that. There's so many different things that you can do. Some people do Tai Chi.
Mm-hmm.
Yeah, there's a million things, whatever it is that just slightly changes your mindset so that you don't pick that up, is great. Do you have any methods that you use, like once the car's on fire, in case you didn't catch it before the car was on fire, after the warning light?
Yeah, definitely. For me, I kind of just let myself feel those feelings. So if I have to cry for 2 hours, I'll cry for 2 hours.
Mm-hmm.
Um, I definitely talk about it with my husband.
Mm-hmm.
He's a great resource. And I feel bad in the moment because it stresses him out, obviously, because he feels
Mm-hmm.
helpless
Okay.
and he doesn't like to see me upset. But also, he is a huge source of comfort for me, and he centers me, he
Mm-hmm.
grounds me. So it brings me back to a place where I can feel like it's okay and it's going to be okay.
Right.
So, and I just had this moment like a couple of days ago. My daughter, who's like majoring in psychology, she's like my therapist, and she brought so much stuff out of me, and I'm like bawling in my living room.
Ah,
But I'm comfortable enough to do that in front of him and with my children. They're older now, but I can be vulnerable with them,
right.
and they bring me back and say, "Mommy, it's okay." And they remind me of a lot of the positive things.
Mm-hmm.
I'm able to do that. And if it gets a bit harder than that, then I have my therapist I can, reach out to for like an emergency call, or an appointment,
Right.
just to kind of help put things into perspective. And then I just use my regular distraction methods, whether that's a Lord of the Rings marathon, that's a good 11 hours of distraction from
Mm-hmm.
the three movies, or doing crossword puzzles, or just watching documentaries,
Mm-hmm.
something that's going to help me not focus on whatever is going on in my brain,
You're right.
however much time that I need it to.
Right.
Um, and sometimes that's the best self care we can give ourselves,
Mm-hmm.
is to distract by focusing on something that's more positive and less, you know, internal. Something very external really helps me.
Right. Can you comment on being a mom with the migraine and the depression and the anxiety?
It's hard. It's been very, very hard.
Yeah.
And I'm still amazed at how well my children have turned out.
I've met them. They're awesome.
Thank you. But I've had so many moments of feeling like such an inadequate parent,
Aw.
because motherhood has always been something I've wanted to, you know, be a part of and achieve. And that was a huge goal of mine. And so when chronic migraine hit me when my children were still in elementary school,
Right.
it really threw me for a loop. And
Mm-hmm.
um, I became an expert at pushing through all of my pain to make sure that they were taken care of. And they have been really excellent at telling me that I have been more than enough to them,
Aw.
even when I've had really bad days and I couldn't get out of bed. Um,
Yeah.
so
They're
I'm
good at
very
that. Kids are
thank
good at
you.
that. Yeah.
They are.
Uh-huh.
I'm so amazed, but it's been really, really hard having those moments where my diseases have gotten the best of me in front of my children,
Aw.
especially the depression and the anxiety, because they've seen me, you know, really at rock bottom, and
They've
that's
seen
not
you low.
something they
Yeah,
have
and that's
lower
okay.
than low. Yeah,
And that's okay. You're a great
yeah.
mom. I've seen it, and they're proud
Thanks,
of you. Yeah.
thanks.
Yeah, you do a great job. So, is there anything else you'd like to add to our discussion on migraine and depression?
Only that, it's just always important for me, for anybody living with any of these three things, to remind themselves that they are not their illness,
Mm-hmm.
like we were talking about earlier.
Mm-hmm.
Just keep that as your main focus whenever things get really, really difficult. Just remind yourself, like, okay, I am a person with migraine,
Mm-hmm.
or I'm a person that has depression or that has anxiety. They do not have me.
Right. Yeah. Jaime, your blog is so awesome and it's so popular. Everyone loves it. Can you tell everyone the website, what it is, so that they can go there?
Sure. So
Yeah.
my blog is called The Migraine Diva, and you can find it at themigrainediva.com.
Okay. So thank you, Jaime. Thank you so much. That was awesome. And thank you, everyone, for joining us today. Please join us again next week on Heads Up, the weekly webcast and podcast of the National Headache Foundation.